iCare is a tool that will help us save lives. It provides best practice alerts that alerts the nursing team immediately if our patient is declining. As we transition from emergency department to inpatient, even to lifelong health is going to be the one thing that I can't speak enough about.
iCare will give us a team approach, all of us working together in caring for our patient. It's simple, it's safe, and it makes sense.
One of the biggest things that will improve patient care, which is what we're all interested in, is the fact that with the iCare system, we will have all of the patient's records, outpatient records, emergency room records, inpatients, and procedure within one system.
iCare is going to make your life easier. It's going to make your job easier. We've worked really hard to make sure that all of the workflows are consistent so that if they go to one emergency department, they will have the same care and the same orders and the same treatments as they would at another emergency department.
I see iCare as providing continuity of care. All the patient's information is all in one place and that is accessed by all of us.
Knowing that you just have to go to one place and you're going to be able to do labs, you're going to be being able to do radiology, records, if you want to access records, if they went to Walter Reed, and being able to pull that up instantly is going to be a nice function. It's just an added safety, and in our culture, right, I mean safety culture right now, that's, you want that, any extra checks that we can have.
iCare is going to offer the patient that consistency from a doctor's office visit going to a hospital encounter, as well as increasing patient safety when they transfer from one environment to another.
The more information that we can get and collaborate with other healthcare providers, it gives us a better clinical picture of our patient. It improves our workflow, safety for our patients at the bedside.
Having the ability to use barcode medication administration in the emergency department is one of the instrumental tools that iCare will provide. We don't currently have this, and this offers an extra safety check to provide our patients with safe care.
I'm proud to have been involved in the iCare project. I think that this is giving back to the Riverside Health System, and this is going to transform the way people provide care to their patients in the health system.
iCare is a one-stop place for all the information that I need to be able to take care of my patients the best that I can.
iCare will bring together outpatient records, inpatient records, ER records, so we have one chart which will make everybody's life easier.
iCare will make transitions of care much safer for patients.
If the patient goes from the emergency room to the operating room, again, we'll be able to see in real-time medication administration where we couldn't see that before. And then when the patient reaches the floor, not only will pharmacy be able to see all those medications that have already been administered, but the physicians and the nurses who are now taking care of the patient can see that. So it's going to give us a better view of the patient as a whole and what has gone on with that patient during the course of the stay.
So if they've been to a physician practice and then they come into our emergency department and we already can see that they were in their physician practice yesterday for a similar problem and we already know about that, I think it makes it a more personal experience for the patient because then they feel like we know something about them, we're in touch with them and what's going on in their medical care.
We're also going to have better medication administration records in our lifelong health and PACE facilities. So rather than having med lists that are printed once a month from a computer system and then manually updated monthly by our clinical pharmacists, we will have a real-time record that will reduce transcription errors and make that process safer in lifelong health.
So transferring patients will be amazing. You'll be able to say, oh, this patient had surgery 6 months ago at Regional. We're doing this here at Walter Reed. Maybe they had trouble with intubation here. We know that on the forefront, so we're ready to take care of that if we need to when we do our cases. I think it'll be amazing from system to system, hospital to hospital, and even department to department.
Being able to have our medical record in the emergency department, the same as what the inpatient medical record is, will be huge for patient safety.
On the front side, that's the main important part, is taking care of our patients, and I think it will allow our nurses and our pre-op nurses and our OR nurses and our PACU nurses to be able to spend more time with their patients and not have to worry about their paperwork so much. That extra minute that you spend with your patient, that extra, well, let me go get this for you, because I have time to do that. I don't have to send for somebody else to do it. I can do it. I'm your nurse. I can take care of you. I can do it. And I think that makes a difference.
I think one of the big advantages of iCare is we'll have a single medicine list that's in one place. We'll have one set of allergies, one set of patient problems. It'll be easier to identify people in iCare.
So iCare is an electronic medical record system that is comprehensive, and it's going to be the record for all of our patients at all of their points of entry into Riverside. So one of the major advantages is that we're all going to be on the same system, so it's going to allow us to provide that seamless continuity of care at all the different levels.
So when you come into a system like iCare, where all of that comes into one place, that'll quickly avoid multiple bills for whether that patient is coming in from their physician's office and they have an order for labs or an x-ray or another procedure, and puts it all in one centralized place, and again minimizing the need for rebills due to late charges, because we are engaging our providers and our clinicians up front, so that if there are any items that were accidentally missed or that were erroneously captured, that they can quickly correct that.
iCare will help support the Riverside Care difference because it'll do the things that we want to do. Heal patients, make them safe, honor their wishes. Everything's going to be in one location, so we'll actually be able to look at those things every time you contact a patient, every time you have an interaction with a patient using EMR.
So it streamlines the process for that patient and offers them, a quick process is where they come in, they have everything in one place, and then even from a billing perspective, that they get one bill and avoid multiple instances of that.
So at the Riverside Care difference, I think everybody sees differently, but one of the things that I think is important, that the overwhelming majority of people who practice here live here. We practice in a community, and the patients are our neighbors, our friends, and fellow citizens. And that is different than the way some of the other entities practice, where people who come here are coming from outside the community. So we think that at Riverside we have that little extra touch because the people we're caring for are people that are important to us. And I think that anything that enables us to deliver better care and perhaps more personalized care is going to be a benefit. And I think that the Epic system, or iCare, has a great opportunity to provide that. So iCare would be the new electronic medical record system that we are installing at Riverside. The MyChart is a more sophisticated, globally more available system. The patients will see a benefit because, first of all, the doctors will be more efficient. Improved efficiency leads to less frustration. Diminished frustration leads to decreased mistakes. But then more importantly, you'll have access to all the information that you need, and the opportunity to make mistakes, I think, will be limited as compared to the system we're using.
So one of the biggest advances with iCare in safety is going to be the extension of barcode administration. So medications have barcodes on them, and our computer system allows us to match up those barcodes to the patient order and the time. So we're able to use barcodes to verify that we have the right patient, the right drug, the right dose, and the right time to keep our patients safer.
It's a newer, more modern, more comprehensive electronic medical record. From what I've seen, it's going to be much easier to use, friendlier for users, and I think that's going to translate into better patient care at the end of the day.
It's going to give us a comprehensive record where you'll get to see everyone's input. So you'll get to see the physician's input, you'll get to see the nurse's input, the pharmacists, the physical therapists, the dietitians. Everyone who provides care for that patient will get a say, and it will all be documented and easily accessible in iCare. And that's the kind of medical record I want for my loved ones. So I think that's how iCare is kind of living the Riverside Care difference.
So many times when a patient comes from a physician's office or from another long-term care facility, we're asking them questions and they're saying, well, isn't that in my medical record? And we don't have that at our fingertips at that point. And so to them, I think it will mean a lot that they don't have to try to tell us what is wrong or what they're on, and it makes it look like we're all on the same team. I feel like it's a better team approach.